Welcome back to Chicago Now. We told you that we're going to be switching gears a little bit, talking about an important conversation, Menopause Awareness Month. That is month of October. And here's an interesting stat. Only 20 to 25% of women were treated for menopause, and the percentage is even lower in brown and black communities. I want to bring in Dr. Susan Scanlon, the president of Midwest Center for Women's Healthcare. Thank you so much for joining us over Zoom.
Thank you so much for having me.
You know, we have to talk about, obviously, it being the Awareness Month. Why is, focusing on this topic so necessary, and how does it help kind of spread awareness throughout the country?
Yes, 1.3 million women will enter either perimenopause or menopause every year. And by 2030, there will be approximately 1 billion women worldwide in menopause. So it's affecting nearly half the population, but yet the topic is not discussed enough. So Menopause Awareness Month is great for bringing this vital women's health conversation to the forefront.
You know, it is interesting. As a young person, obviously I don't understand, but you hear like hushed conversations like, oh, she's having a hot flash. Oh, something else is happening. Why do you think, women are still suffering in silence and not being open about what they're experiencing?
Well, that's a great question. Only about, 1 in 4 women actually seek out care. And it's because the research has shown either that they think that there's not treatments available, or they feel ashamed. They think they have to live through it. And that's just simply not true. There are many evidence-based treatment options available for women these days, from lifestyle changes to hormone therapy to non-hormonal options. So I always encourage women to don't be afraid of all these changes in your body. It's something that you can tackle with the right help, with good medicine and support. So seek out a physician that specializes in menopause and get the help you need.
But I will say, even though it might not sound scary to you, might sound scary to people watching at home, hormone therapy, the first one you mentioned with you're changing your cells, what do those really mean? And are they painful treatments? Are they really intense treatments?
Back in 2002, the Women's Health Initiative came out and made everyone afraid, not only the patients, but also the physicians, about using hormone therapy. And because there was concern about increased cancer risk. Well, in the last 15 years, that research has been looked at and hashed and rehashed at all the conferences. And the conclusion is that hormone therapy is actually safe for most women to use. There are restrictions, certainly, if someone has an estrogen-containing cancer or a clotting disorder or liver disease, for example, hormone therapy is not really right for them. They have other options available to them. But hormone therapy for most women is safe to use. There isn't pain, to answer your question. There's not pain involved in it. It actually helps reduce their symptoms of menopause, the hot flashes, the night sweats, the painful intercourse, the brain fog. But even more importantly, it sets them up for long-term health. Bone health, heart health, cognitive health, so even reduction of type 2 diabetes. So talk to your doctor so that you can get the information you need, and if your doctor isn't comfortable with it, then seek out a menopause expert.
It sounds like obviously you have a lot of experience on this topic. Are you finding that maybe within the last 5, 10, 15 years, people are more willing to talk about this, having open conversations at home?
Definitely. Thankfully, for all the awareness that's out there over the last few years, more patients seek out care. I've been a certified menopause practitioner for 15 years. I've taken care of menopause and perimenopause my entire career. And I will say in the last few years, there's just been an abundance of patients seeking out help. And I applaud that. The more awareness we can have, and that's what's so great about Menopause Awareness Month, is bringing that conversation to the forefront. People feel more comfortable seeking out care. I think what's important is for the doctors to get comfortable with the care. Only about 1/3 of physicians receive any sort of training in medical school or residency, and many of them actually have a passion for obstetrics as opposed to gynecology. So as the education grows and we close that education gap in the healthcare system with the physicians and the nurse practitioners, whoever's providing the care, I think we'll have more access to care for women, which is fantastic in what we need.
Dr. Scanlon, I kind of want to call out the guys, because I don't think, now that I am reflecting, that I've heard one guy talk about menopause or like actually say it out of their mouth, let alone period, anything like that. But why is it so important for them to also join the conversation and make sure maybe their partner, you know, their mother, their aunt is also comfortable sharing what they're experiencing?
I don't think it's a gender thing. I think that people have a passion for certain areas of medicine. I acknowledge maybe there's some people who are more uncomfortable with the topic. I'm just so comfortable with the topic, so I talk about it quite freely. Here I'm the third generation of doctors in my family, and my father and both my grandfathers were doctors, and one of them was an OBGYN, my grandfather. I don't know at that time if they talked about menopause at all, but I encourage all people to embrace the topic because half the population is suffering, and it's not about future statistics. It's about now. So I think I agree with you. People need to be comfortable with the topics, no matter who they are.
Yeah, even if you're young and it's far away in the future. What is a good resource for women or for anyone to get the latest information about menopause?
I think the best resource is the Menopause Society. If you go on their website, it's called menopause.org. Not only can you find a certified menopause practitioner that you can connect with in your area, but also they have great resources. If you want to read about hormone therapy, I would encourage you to all take a look at, it's called the Menopause Society Position Statement on Hormone Therapy from 2022. It's very detailed, maybe beyond the scope of the average reader, but it dives into each area of your body and how hormone therapy can benefit that or not have benefit or bring potential trouble. And so I think that's a great resource. And then bring that information to your doctor to talk that through and see what can you do to help you feel best and then to have your best long-term health.
I think that's another thing, doctor, is that people are trying to do their own research or do research for others, and they run into this long pages on pages study and they kind of give up. But do you suggest, hey, sticking through it and actually looking through the whole document, maybe you're going to get more out of it than you think?
I think there's a lot of great valid resources that are out there. I think meeting with a certified menopause practitioner can help you decipher all that information. So a lot of the patients will bring in articles that they've read or something they've pulled up online, or they've done a telehealth meeting with an online resource, and they're not quite certain if it's safe to use or that what was given to them is actually reliable. I always walk through that with the patients so that they can feel comfortable with the information that they're reading and really understand how it affects their life.
So you've said it a couple of times, but I just want to make sure, everyone at home is getting it right too. So women should seek out a doctor with special training in menopause, or can you start with your primary physician and maybe move to someone else if you're experiencing a little more intense symptoms?
I think just meeting with a doctor that you're comfortable with. You want someone that you feel comfortable talking to about, because this is a pretty personal experience for people that make many patients uncomfortable. So to get comfortable and to open up, I think talk to whichever doctor makes you feel comfortable. My main point, though, is not every doctor is educated on all the treatment options, and many still have fear of hormone therapy, for example. So if that's the case, I think that's a situation to seek out a menopause specialist. A certified menopause practitioner will certainly be comfortable and confident in giving you all your treatment options, pros, cons, and then decide together with you as the patient what's your best treatment option to feel better.
I know that we're jumping around a little bit, but in case we missed it for people at home, you mentioned, some of the symptoms, but what are some maybe more hidden symptoms that people are struggling with? And if they experience, they should go to the doctor.
Sure. Well, most people know about hot flashes and night sweats, but many women don't know, for example, joint pain is associated with menopause, brain fog. Certainly the weight gain, women struggle with their weight throughout all stages of life, but it really becomes troublesome during that perimenopausal transition. Vaginal dryness, painful intercourse, challenges with intimacy. Those are common symptoms in menopause, and there are a lot of treatment options available. So rather than suffering in silence and having it impact the quality of your life, I encourage women to not be afraid to be aware that there are treatment options and talk to your doctor about them so they can help you feel the best you can.
You know, I want to revisit the statistic that we shared from AARP that showed only 20 to 25% of women were treated for menopause. The percentage is even lower for Black and Latino women. You know, is there something that you all are doing to help really hone in and get that group treatment for what they're experiencing?
Well, our practice is called Midwest Center for Women's Healthcare. We're the largest OBGYN practice in the state of Illinois. We have 24 locations. So part of the reason women aren't getting care is because they don't have access to care. So with our expanding number of providers, we have 109 providers now in 24 locations. Furthermore, we do telehealth. So increasing access to care is really a critical component to helping women get the care that they need. So Midwest Center for Women's Health Care is really trying to expand our access to the patient care.
Okay. You know, one more thing, I guess, for people at home, is there a good, you know, I guess you gave a good place to find some more information, but maybe to just keep a little more updated, is there anything else that they should look out for online?
Yeah, you have to be careful. You know, there's a lot of businesses that are popping up.
That's true.
And you just want to be sure that the information you're receiving is evidence-based. There's a lot of places where, without much investigation into the person's health, you can just access medications. So you want to be sure that you are a good candidate for them. And again, as I said, most patients can use hormone therapy, but there are several patients, their medical conditions would make it such that it's not safe. And you want to be sure that the resource that you may be reaching out to is going to dive deep enough into your history to be sure that you're getting the best, safest, most effective treatment.
You know, I know I'm throwing a lot of questions at you, doctor, but
no, it's great. I welcome
younger people.
Thanks for having me on. I love talking about this.
Because again, it's not a topic that we're usually, you know, chatting about. But for younger people, is menopause coming early for more recent generations than it ever has before? You know, through your years of work.
Well, I think that, I know that perimenopause for many women begins in their mid 40s. Mm-hmm. Several are in the early 40s. I think that some of the symptoms overlap, where women aren't necessarily in perimenopause yet, but they have symptoms of PMS, for example, and they struggle with weight gain. They may have polycystic ovarian syndrome. So I think the group of patients in their 30s who are now coming forward thinking they're in menopause may have actually something else happening. And so that's where speaking to a doctor who's comfortable with the topics, that can really dive deep into what your symptoms are, do the appropriate testing to give you an accurate diagnosis, because it's very confusing and scary to a lot of patients. But no, perimenopause has always been around, starting in their 40s, and it just wasn't talked about enough. In my practice, it certainly has always been talked about, and but as this knowledge is growing and research is growing, science is able to educate women better and physicians better, so that you know, that information gets out there. But yes, I think I see more patients at a younger age, and I applaud that, because I think women have been suffering through it, and they're, especially in their early 40s, they're thinking, you know, they're just going crazy and overworked and chasing the kids around in the carpools and making the dinner and doing everything. And they just think they're run down, but maybe it's actually something's brewing with their hormones. So if you're not feeling good, if you're not feeling sharp, if you're having troubles and symptoms that don't make sense, then talk to the doctor and bring forth that topic. But also, if the doctor tells you it's not that, be open to what the doctor's saying. Hey, you know what? It might actually be PCOS, or maybe you've got endometriosis, or you know, PMDD. So there's many overlapping symptoms to look into, as women go through this.
Well, and I ask you that question because, you know, we get so much medical advice that might not be the best medical advice from TikTok, from Instagram. And I remember scrolling through and seeing that, you know, there's a shocking number of young people getting, you know, menopause early because of ultra-processed food, because of environmental issues. But you're saying it really is natural to see it during that age, the 40s, and it's just kind of the cycle of life.
Well, women, people have been going into perimenopause in their early to mid 40s for generations. It's just, unfortunately, doctors weren't educated on it and didn't bring it forward to the patient to help them feel better. Many women have suffered through symptoms for a long time. Your question's great about the ultra processed foods and the plastics. I do worry about that. I raise my kids with organic food. I drink tea all the time, so I have sought out organic tea leaves so that I'm not using the tea bags. That is a reality we face right now. We need more information. It has been shown to affect fertility. It's in all parts of our bodies. It's in all of our foods. So we need more research and the impact that has on menopause and at what age it's actually going to impact women entering the perimenopausal phase. More research to come, but that is a big topic that we all need to face as the medical community.
I'm glad you mentioned that. Okay, my last pressing question, because you're a doctor, you mentioned tea that you drink. What kind of tea do you drink, and is it helping maybe the symptoms so that other people at home can know?
Well, for me personally, I feel better with tea than I do with coffee. Okay. There's a lot of great benefits to black coffee. It's all the rest of the things that are put in the coffee. For me, I feel less bloated, and I don't know, I just feel better with tea. I buy loose leaf tea from that Palace of Tea, and I buy, and I have the little strainer that I put in the hot water. I make the hot water in a kettle. I do not use a microwave. It broke years ago, and I just never got a new one. And so I use the stovetop. I do the best that I can. I try and eat organic. My kids are out of the house, so it's easier just to go out to eat. But going out to eat, it's not necessarily the healthiest foods. They taste great, but if you're looking for something as healthy as it can be in an organic fashion, really cooking it yourself is kind of the way to go.
I know, we need to keep it in mind, but I'm a sucker for those really sugary coffees and the fast food line and stuff like that. Dr. Scanlon, Thank you so much for joining us. I appreciate it.
Thanks for having me on.
It was a pleasure.